別係衛生防護中心傳染病處首席醫生歐家榮醫生，同埋醫院管理局總行政經理李立業醫生。咁兩位醫生呢會匯報醫管局方面嘅情況同埋陽性個案最新嘅資料嘅。咁先請李醫生。
大家好。醫管局現時總共有2234名嘅確診病人留醫，其中有331名嘅病人係新增嘅確診病人嘅。入住呢個隔離設施嘅病人裏邊有514名嘅病人喺隔離病房，196名喺二線病房，647名嘅病人喺北大嶼山醫院香港感染控制中心，74名嘅病人喺亞博館新冠治療中心。呢度係有248名係新增嘅確診病人，6名嘅病人呢，我哋新情報係情況危殆嘅，2位打咗3針，3位打咗2針，同埋1位冇任何疫苗記錄。5名嘅病人情況嚴重，留醫總共有40名危殆同30名嘅嚴重病人，其中12名嘅危殆病人係喺深切治療部嗰度留醫。琴日離世嘅個案呢，呈報咗9宗。4男5女，年齡介乎70到108歲，當中5位嘅離世病人係未完成嘅3針疫苗，咁亦都有2位係嚟自院舍嘅。呢9位病人我都喺度講一講嚇。70歲嘅女性打咗3針，佢本身有呢個嘅肺動脈高血壓同埋免疫系統疾病嘅，佢喺8月9號經明愛醫院急症室入院，氣促發燒，另外就快速測試同埋個核酸測試都係陽性嘅，咁佢入咗內科病房，但係情況都係持續差，喺8月23號夜晚過咗身。80歲女性都係打咗3針嘅，咁本身
day before. On admission, her situation was bad, so she was intubated. So from a sample taken from her throat, the CT value was 20. That was positive. She was shown to have pneumonia via X-ray. She was prescribed with drug as well as oxygen support. Situation deteriorated until the 24th when she passed away. 90-year-old male with no vaccination record, hypertension, arrhythmia as well as lung disease. On the 3rd of August, he was admitted to the Neversole Hospital, RAT and PCR test positive. Shortness of breath and fever. X-ray revealed pneumonia. He was then transferred to the North Lantau Infection Control Center for treatment. On the 17th of August, he was transferred back to the Neversole Hospital. On the 24th, he passed away in the morning. The 4th deceased patient, 108-year-old female with 2 jabs, a care home resident. She was transferred to the A&E at Twin Moon from AWE on the 7th of August because of fever. PCR test positive. Her oxygen level dropped, requiring oxygen support, and the X-ray turned for the worse and passed away subsequently. 83-year-old male with 2 jabs with hypertension, and also coronary disease. On the 11th of August, he was taken into Prince of Wales Hospital because of loss of appetite and shortness of breath. RAT and PCR were both negative. On the 11th as well as the 14th, both negative. On the 19th of August, the test became positive. Situation got worse, requiring high-level oxygen support, and passed away on the 24th of August. The 6th patient is an 88-year-old male with 2 jabs with cerebral hemorrhage and coronary disease. On the 15th, he was admitted to the North Lantau Infection Center because of fever, RAT positive, PCR also positive. X-ray revealed pneumonia. He was also found to have a colon hemorrhaging. He was transferred to the Princess Margaret Hospital for surgical treatment. In the hospital, starting from the 22nd, his breathing got worse and passed away on the 24th. 102-year-old female with 2 jabs, a care home resident with diabetes and also a tube feeding required. On the 15th, she was taken into the Caritas Medical Center because of shortness of breath and fever, RAT negative. Screening test, however, revealed her to be a virus carrier. On the 23rd of August, her blood oxygen level dropped and passed away in the afternoon of the 24th of August. Besides the 7 patients, there were also 2 other patients whose deaths we believe are not to be linked with coronavirus. 84-year-old male with 2 jabs with diabetes and a renal problem. He was taken into the Princess Mary Hospital because of unconsciousness. He was intubated and with arrhythmia. He was given a CPR. However, he passed away at 2 p.m. on the 24th. A RAT revealed him to be a patient. Another deceased patient, 96-year-old female patient with 3 jabs, hypertension, diabetes, coronary disease. She was admitted to the United Christian Hospital because of coughing and edema. RAT positive, prescribed with antiviral drugs, shortness of breath situation got worse subsequently. Now she her stomach ache got worse subsequently. On the 24th of August, around 12 o'clock, she passed away. Also, yesterday, 271 patients recovered, including 245 patients discharged. 7 patients were found to be confirmed on screening. 12 patients are close contacts. 165 caring staff, healthcare staff members are infected, with 42 returning to the positions. Now, hospital clusters. Two Moon Hospital geriatric ward and medicine ward, a 76-year-old female found to be confirmed on screening, and then we have found 4 more patients between the age of 57 and 95 to be patients. Now the patient is in stable condition. Now, Port Royal Hospital, a geriatric ward, an assistant was found to be positive on the 27th. Through tracing, we have found another staff member and 2 other male patients are confirmed. The 2 patients are in stable condition and also under isolation. The 2 wards have stopped receiving new patients and also visitation. Thorough cleansing and disinfection is being arranged. Now, that's all for my reports. Thank you. Good afternoon. Thank you, Dr. Lee. Now, on the new cases reported yesterday on the 24th of August. Yesterday, locally infection totaled at 8,282, a new high recently, including 2,960 confirmed via PCR test, 5,322 confirmed via RAT, and then confirmed via PCR test. 297 cases were imported yesterday, including 258 confirmed via PCR test, 39 on RAT. For deaths, as Dr. Lee mentioned, there were 9 new deaths so far. In the 5th wave, we have recorded 9,430 deaths. Among the 297 imported cases yesterday, 144 were caught at the airport's temporary specimen collection center. 86 were found to be positive in quarantine hotel. The remaining 67 were found at the community testing centers, with 58 found from samples between the 4th and the 7th day, and the remaining 9 cases were after that, with higher CT values. believed to be a reinfection or re-positive cases. Now, 53 places have imported cases, with 9 places imported more than 10 cases. They are Thailand, the UK, India, the Philippines, Singapore, the US, France, Canada, and Australia.
嘅40
The remaining 44 countries imported less than 10 cases. In the homes, 9 homes had reported new cases, including 5 elderly homes with 9 residents and 2 staff members, and 4 disability homes with 4 residents reported. These 9 homes together have 70 residents as close contacts, and they have to be in AWD, and they are in Eastern Fongyuan, 2 residents, and Shatin, Sixikyuan, Kosing home, 1 resident confirmed, and Kowloon City Global home, 4 residents, 2 staff confirmed. Sai Kung Christian Sai Kung Juyan home, 1 resident confirmed. Shatin Sanman Fuk Tai Wei home, 1 resident confirmed. South District Zhonghua Group of Hospital, JC Old Age Home, 1 resident. Fu Hong Association, Pui Chap Hin, 1 resident confirmed. And Eastern District Yuen Lok Koi, 1 resident confirmed. And today there is 1 home with more cases, and that is Kowloon City Wan Kau Global home. And it is a 2-story building with 68 residents and 28 staff. And on the 3rd floor, there are 2 carers confirmed. And yesterday was the last day of reporting to work, and they have had 3 jabs. At the end of the workday, they had slight symptoms, and the RAT showed negative results. But since there are confirmed cases, all staff will have to go through PRC tests. And these 2 staff members yesterday went for the PRC test, and the CT value is 26 and 28. There are 4 residents which have been proved positive, 2 yesterday and 2 found positive today. And the remaining 31 residents will have to be tested and quarantined. And there is another old age home previously announced. We found that there are relatively more cases, and this is Wan Chai Heng Hoi Buddhist Li Ka-shing Care Elderly Home. On the 19th of August, we have announced that there was a cluster, and on the 1st floor, there are 4 residents and 1 staff, cleaner, showing positive results. And because there is a cluster, same floor, 36 residents are close contacts and are sent to AWE. These 36 close contacts, of which 27 are in AWE, and during that time, they have shown positive. And on the 21st to 23rd of August, on the 6th floor, there are 6 more staff members proven positive. So altogether, there are 31 residents positive. And on the 3rd floor, there are 2 residents and 4 staff members showing positive results on the 23rd and 24th of August, and they've been moved to AWE. In the past 7 days, there are 66 homes with positive cases, 25 disability and 41 old age homes. And with 128 cases, 108 being residents and 20 being staff. School holiday today, so no school reports. And we have received 66 cases yesterday with schools reported with 49 students and 17 staff members involving 51 schools, 24 kindergartens, 17 primaries, and 14 secondary schools. There are no additional schools which need to suspend classes. As for the strain in the sample tested by the authorities, 43.9% are L452R. And compared to the 40.9% the previous day, this is another increase. And in the samples, most of it, 90% are BA5 substrain. As for BA2.12.2, the percentage is stable at 7.7% yesterday. Lastly, I would want to mention that at present, the COVID situation is getting more serious, and the number of cases confirmed is over 8,000. In 2 to 3 days, every day, the cases have increased by about 2,000, from 6,000 to 8,200 today. Just took a couple of days for that increase to materialize. So the increase is on the rise, and we believe that the cases will soon exceed 10,000, and this will create a very serious pressure on the healthcare system. I strongly recommend to citizens to increase all cautions, enhance your measures for and also refrain from attending gatherings or cross-family gatherings, and to conduct RAT and PCR tests regularly, especially for those with elderlies or physically weak members in the family. And going out, please put on tight-fitting masks and use highly effective masks such as KN95 or more masks than one. And in public areas, unless you're eating, do not remove your mask. And once found positive, report as soon as possible. And if in the residential in your home, there is no independent room or lavatories, or where there are non-positive old age persons in the house, then you should go to isolation facilities, quarantine facilities, to avoid transferring the disease to them. And also, please take the jab as soon as possible. Parents, especially for 6 months to 11-year-old groups, parents, please take your children to vaccination as soon as possible. And for teachers, they will have to take RAT every day, and where there are symptoms, refrain from going to school. And students as well, where there are symptoms, it is likely that you are already COVID positive. And where there are symptoms, even if the RAT shows negative result, you should refrain from going to school, but rather go for PCR tests as soon as possible. Q&A time. Introduce yourself before you put the question to the doctors. In the front, the gentleman. Cable. What is a number that you have in mind of cases before you will make the measures more stringent? Secondly, for the 2 staff members on the 2nd floor in the Kowloon City Old Age Home, those 2 staff members, have they been to other floors, please? Well, as you can see, every day there is a clear increase, and for compared to the day before, it is a few hundred or 1,000 cases more. And with this situation, we are worried. It shows that in the community, the transmission chain or the transmission rate, it had been rapidly increasing. We do not want to put up a cookie cutter measure. We want to have restrictions that are reasonable, but because of the increase in cases, we want to lower as much as possible the transmission rate in the community. And with that, the citizens will have to do their prevention measures well, and as much as possible, conduct tests. And once found positive, they should isolate themselves not to transmit the disease to others and to lower community transmission.
咁
We would like to be more accurate in terms of fighting the epidemic, especially concerning vulnerable people who are close contacts and who are patients themselves. However, if the situation gets worse, the government would take into account a series of factors, including economy as well as the epidemic situation in taking out measures. Sorry, your second question, which elderly care home you were talking about? Well, the one in Kowloon City, the international elderly care home in Kowloon City, there are 2 floors. Only the 3rd floor has an outbreak. There are 35 residents on that floor. 2 staff members are also working on that floor. So far, we think they haven't been to other floors, but to be safe, the other floor where there are no patients, the residents and staff members there are also subject to PCR tests. Any more questions? The lady in the back. Good afternoon, doctors. I'm from Mingpao Daily. On the wedding banquet cluster mentioned by the HA yesterday, do we have a new information? How do we have other caring healthcare staff infected? Concerning a transfer of patients to private hospitals, there are media reports that the utilization rate is not high. However, 2/3 of the cases are considered not suitable for transfer. Now, 400 patients there. How many patients have been transferred to private hospitals? So what about patients whose family members refuse to have them transferred? So usually, how long would it take to transfer patients? And also, it should take place within the cluster. However, in certain clusters, there are fewer private hospitals. So would you relax the requirements? Now, the Lee Ka-shing elderly care home, how many floors are there? How many residents are confirmed? What about the residents on the 2nd and the 4th floor? Do we have severe cases? And also the international care home, you said that some residents were infected earlier. So when was patient 0 infected? Now that case, an 87-year-old male disease patients, PCR tests and RAT were negative at the beginning. So later on, when the PCR was positive, what was the CT value, and was he infected within the care home setting? Now, on the private hospitals arrangement, we have 178 patients being treated in private hospitals. So far, there are 364 beds available. So we don't have the statistics of patients whom we revise the decision of transfer or refuse to be transferred. However, more than 50% of the patients were successfully transferred, but there were other reasons for transfer are not taking place. So we have been coordinating our efforts with the private hospitals to rationalize the arrangements and also to speed up the selection of patients and the transfer process. As you have mentioned, for some clusters, there are fewer private hospitals. So for private hospitals with beds available, we would allow for cross-cluster transfer of patients. So we have been optimizing the arrangement. Concerning the wedding banquet, we have 5 more doctors confirmed today. They work in the surgical department of the Buddhist Hospital, the gynecologist department of Kwong Wah Hospital with 2 doctors, radiology departments in Kwong Wah Hospital and another hospital. So no patients are classified as close contacts because of this, and the operation of hospitals are not affected. So the 87-year-old deceased patient on the mission on the 11th and the 14th, the PCR tests were negative. However, on the 19th, his PCR test came back positive with a CT value at 30. So we believe that he was infected in the hospital setting. Now, the two elderly care home, first one, Wan Chai Buddhist Li Ka-shing elderly care home, a rather large care home with 6 floors, 226 residents in total. Now, for floors experiencing outbreak, they are the second and the fourth floor. So residents on these 2 floors are classified as close contacts and have been evacuated. The vaccination rates for the care home, first dose 95%, second dose 90%. However, third dose it is only 78%. The other care home with new cases appearing today is the International Elderly Care Home. Now, the first patients, the earliest cases were yesterday with 2 residents confirmed. The staff members were not infected. Residents were not allowed to go out, so we suspect a spread, a transmission caused by staff members. So we have advised PCR tests for all staff members as soon as possible. Today, we have found another 2 staff members positive with a PCR with samples taken yesterday and confirmed to be positive today. And also 2 residents are tested positive today as well. Next question, the lady in the front. Good afternoon, I'm from TVB. Following up on another reporter's question on private hospitals. In transferring cases to private hospitals, is there a set of established procedures? And on average, how many days are required to transfer a case? So we should review the existing practice with private hospitals. Now, on transfer of patients, we have our liaison units within different clusters. So we have a set of arrangements. Usually, we would complete the transfer procedure within a day. Previously, because of other factors, it would take longer, but the situation has improved now. Next question, the lady in the back.
From RTHK. So today there are more than 8,000 new infections. So is this considered as another wave of COVID already? Or when does the CHP expect another wave? And how are hospitals and treatment facilities coping with the situation? Are hospital beds overloaded at the moment? And how is the cooperation with private hospitals as well? Because like the health secretary urged private hospitals to take in more patients yesterday. And can Dr. Lee also recap in English about the wedding banquet cluster involving HA staffs? And also, have the authorities looked into the cluster yet? Like, is there any violations in the rules? Thank you.
Okay.
Maybe I answer the question first. For the epidemic situation, actually the 5th wave in Hong Kong has not ended so far. The number of cases has decreased since April to a low level in May, but however, the daily number of cases remain at a level of about 300 per day, which is significantly much higher than the highest number of cases in the previous 4th wave. And also, we have seen a rebound of the number of cases since early June, increasing gradually and also steadily to a high level. And of note, there is the increase in the speed of increase in cases in the past few days. So that might be related to the wide circulation of BA.5, the Omicron strain in the local community, causing increased transmission of the diseases. And yes.
According to the bed mobilizations and how to cope with, and now we enter the phase 3 bed mobilization plan now. So what we're moving on is we need to open more beds in the hospital to accommodate the increasing number of the COVID cases, and we aim at 4,000 to 500 beds in the hospital. And for the community treatment facility, so for the Hong Kong ICC and also the Asia World Expo, the COVID treatment center, the Hong Kong ICC already reached our upper limit that we have opened 11 wards already that give rise to about 750 beds. And for the community treatment center in AWE, we start with 200 beds, but we have planned to increase more beds so that we can increase our capacity to handle the COVID patients. And in addition to this, we also make use of more holding center, more designated clinic quotas, and also more consultation. And lastly, we make a better utilization of the private hospital bed so that we can handle this surge of the patients. And also we expect the cases will be keep going up, and there will be another surge of the cases. And this is our mobilization plan for the phase 3 meanwhile. And we also have the plan to go into phase 4 if we unfortunately go into that. With respect to the wedding banquet, according to our information, in addition to the 6 doctors we mentioned yesterday, we have another 5 doctors infected. They come from the Hong Kong Baptist Hospital, the surgical department, and 2 from the Kwong Wah Hospital, the obstetrics and the gynecology department, and Kwong Wah Hospital diagnostic radiology department, and also 1 from the Lower Kwai Chung general outpatient department. We still doing the contact tracings, and there's no patient classified as close contact at the moment. And we have made use of some internal deployment, and also we cancel some vacation leaves of some of the doctors, so the hospital service is not influenced. If we find out some staff have violated the regulations, we will initiate human resources procedures to follow up. And also we also like to appeal to the staff that probably they have to try to any big groups of the dinners together, and because there will be chances that will be infected or classified as the close contact. We fully understand our staff also have their social life, but however, if that will be affecting the patient service, and also because of the society have a much higher expectations on our knowledge and our behavior. So we hope that our staff can set a role model to have a higher alertness and try to avoid any dinner with the outside people.
下一題，左手邊。
Next question on the left at the back, the gentleman. AM 730, just now it was mentioned that half of the patients were referred to the private hospitals but were not successful. Why is that? As for the wedding banquet cluster, how many doctors and how many HA staff members were participating in the banquet? And it was mentioned some people will need to cancel their holidays. How many staff members have had to cancel their holidays so that they could substitute for those affected in the banquet? As for participants in the wedding banquet, are there some who have participated but not confirmed, but are not confirmed cases yet? Can they report to work? Just now for the old age home, the Li Ka-shing old age home, how many staff members are affected, and do they cross floors conducting their service? And also, for the affected staff members, I would like to know whether they were affected after they were transferred. Now, for the private hospitals, it is a ballpark figure. If you are talking about, the exact reason why the referral or transfer was not successful, there are many reasons. For example, the patient's situation or condition had changed, or the patient is reluctant to be referred, or the family refuses to be referred or transferred, or where the medical staff feel that it is not suitable as a transfer or referral case, then these are possible reasons. But this is within our expectation. There will be some teething problems in the beginning, and as we go forward, we are optimizing the arrangements. As for the wedding banquet cluster, as mentioned, there are 5 more doctors infected, as mentioned just now, and Kwangwa obstetrician and gynecology department is most affected, but with internal deployment and some staff members canceling holidays, the service is not affected, but I do not have the number as to how many have cancelled their holidays. And as I've mentioned, staff members need their own social life, that we understand, but we also understand that there will be some occasions where they need to attend. But on the other hand, if there is a major infection case or cluster affecting medical service, that would not be good. And we understand that citizens of Hong Kong have a higher expectation of medical staff. As for the Li Ka-shing Elderly Home, there are 118 staff members, and as far as we know, they do not have to cross floors for service except for physiotherapists, etc. And most affected is the first floor or second floor in Chinese. According to our understanding, there is a relatively large-scale outbreak. On the 18th of August, the first case was detected, and on the 19th, arrangements were made for all residents to be tested in AWE, and some of them had been proven infected a few days after. So we believe that it is at AWE with the PCR tests that administered to them that they were proven to be infected. And at AWE, there is sufficient measures to prevent cross-contamination, and there is distance among the beds so as to minimize any transmission among the inmates or residents. So it is impossible for there to be infection at the AWE. And then on the 3rd floor or Chinese 4th floor, there is a smaller outbreak. There are 2 residents and 1 staff member involved. To be cautious, we have arranged for the residents on that floor to be moved to AWE as of yesterday.
View TV News. Could you tell us what are the possible reasons behind the serious outbreak in the residential care home in Wan Chai? Was there a super spreader, and how could the virus transmit across different floors? Will CHP conduct an investigation into the outbreak? And do you see any necessity to beef up infection control measures at the residential care homes? And the second question, is there an urgency to tighten social distancing measures to contain the virus? And where should the authorities start with? Thank you.
Thank you for your question. For the first question on the outbreak in elderly home in Kowloon City, Wan Kau Wu Lei An Lo Yuan, this outbreak involved so far a total of 6 cases, including 4 residents and also 2 staff. For the 2 staff, they were tested positive by PCR. Yesterday, they had their specimen collected yesterday. And for the 4 residents, 2 of them were tested positive by RAT yesterday, and the remaining 2 were tested positive today. So we according to the preliminary epidemiological investigation, we suspected that the sources of this outbreak in this elderly home might be from one of the staff or both staff, because they have onset of symptoms yesterday and also tested positive by PCR yesterday, with one of them having a low CD value about 16, which means the viral load is quite high. So the infectious period will be about 2 days before the onset or the positive specimen. So we suspected that the staff might be infectious in the past few days, and they because they have worked in this home and this might be a cause for the outbreak. Of course, we still need further investigations to see if there are other cases on other floors or among other staff members. And for the second question on social distancing measure, we noticed that there is an accelerated speed of increase of cases in Hong Kong locally in the past few days. And there is a quite rapid increase in the number of cases, indicating that the transmission in the community is increasing. So there is the need for the general public to take additional precaution measures in preventing transmission and also infection among the members of the general public. And they should wear properly wear face masks when they are going out. And also we advise the general public to decrease or minimize participations in large-scale gatherings or meal gatherings so as to decrease the chance of outbreak or transmission. And also we encourage members of the public to have regular testings, including RAT or PCR, especially those with symptoms, and also those who have high-risk persons in their homes. And also if they are tested positive, they must report to our platform so that we can arrange them to have isolations and also pass the information to the hospital authority for early prescription of antiviral medicines. And we hope that the increase will not be very rapid because this will affect our healthcare systems. But we also understand that if the increase is the increase in the number of cases further worsen, we might need to consider tightening some of the social distancing measures.
有冇其他提問？
Any other questions? What about the Li Ka-shing hospital situation? Li Ka-shing elderly care homes situation. How many residents and staff members are infected on the 2 floors? Because it seems that the numbers don't add up. Well, on the 2nd floor, there are 7 staff members and 31 residents infected. I said 9, so it should be 7 staff members and 31 residents infected. And on the 4th floor, 1 staff member and 2 residents infected. That's the end for today's press briefing. Thank you very much.